Good evening, listeners, and a warm welcome to Views on Health. Tonight on the program, we have Dr. Ruwanthi Jayasekara, consultant chest physician at the National Hospital of Sri Lanka. I'm sure listeners will recall that we had Dr. Ruwanthi Jayasekara speak on a good night's sleep last time around. The topic on the program today is unexplained breathlessness. It's something very technical, and I think it's appropriate for me to hand the microphone over to Dr. Jayasekara to explain what unexplained breathlessness is. Over to you, Doctor.
Good evening, and thank you. So before we talk about breathlessness, explained or unexplained, what is normal breathing? So we breathe in and out from the time we are born. And normal breathing, I don't have to remind you, but just to recap, it's we breathe through the nose, we use the diaphragm to breathe, and it is very rhythmic and quiet. It is so rhythmic and quiet that we don't even notice it, that we breathe throughout the day in a 24-hour day. So if something goes wrong in that pattern, then only we start noticing that we are breathing. So if there's something with the nose or the pattern of diaphragmatic breathing or with the rhythm that we are breathing, or if it is not quiet anymore, then we start feeling it, and it is not a comfortable sensation anymore. And then we call it breathlessness, or the medical term is dyspnea. Dyspnea or breathlessness is difficult to define actually, because it is a complex sensation. It is a sensation that is unique to individuals. Someone can describe it as, I can't breathe anymore. I need more effort to take a breath. My chest is tight. I feel I need more air. I'm unsatisfied with my breath. Or the breath feels too small. I can't take the breath all the way into my lungs. So in all these terms, people describe breathlessness. And when someone presents to us as a medical doctor with breathlessness, then we have to figure out from all the causes what can be the underlying diagnosis. So my topic for today is unexplained breathlessness. And before I walk into that territory, what is explained breathlessness? So if you're someone with breathlessness and you've done your basic investigations and your doctor has found out the cause, then your breathlessness is explained. The common causes for breathlessness can be lung diseases or pulmonary, heart diseases or cardiac, neurological conditions, or it can be psychogenic. For example, if you have a pneumonia, if you have asthma, if you have a viral infection, if you have lung blood clots in the lungs, serious conditions like that, you will become breathless. If you have heart failure, if you have conditions called myocarditis where your heart is stressed out, you can have breathlessness. If you have neurological conditions like, you may have heard of terms like myasthenia or Guillain-Barré or congenital muscular problems, or conditions where your thyroxine is low and your muscles are weak, then you become breathless. And those are the examples of neuromuscular conditions leading to breathlessness. If you're someone with very high level of anxiety, or you're suffering from psychiatric conditions, then you can have conditions affecting due to your mental health leading to breathlessness. So all these will show up in your basic investigations, and there will be specific treatment for identified causes. So this will be straightforward. However, there is a huge group of people out there in society who have breathlessness and have piles of investigations done which cannot explain why they are breathless. And because their breathlessness is unexplained, that symptom is not properly managed, and it leads to a lot of poor quality life, and leading to an impact on not only their day-to-day family life, it impacts on the economy. It has an impact on the economy as well because of lost work hours. So, breathlessness has been found in studies globally to be one of the commonest symptoms in acute care. Actually, analysis of symptomatology presenting in acute care hospitals have found out 50% of patients present with 50% of patients in acute care will have breathlessness as a symptom. 25% of patients presenting to outpatient settings will have breathlessness as a symptom. So when you have breathlessness, you will have the basic investigations like a chest X-ray. You may have lung function tests, echocardiogram, thyroid functions. Some people bring files of stress echocardiograms, neurological testings, still testings, all sorts of tests to find out what their cause of breathlessness is. We saw a surge of breathlessness, especially after the COVID pandemic, where most of the tests that were done could not explain why someone was breathless. We would do spirometry, chest X-ray, even CT scans. We would look for blood clots, D-dimers. D-dimer is a blood test that looks for whether you have a blood clot. Contrast-enhanced pulmonary angiogram. Those are CT scans to see whether you have blood clots. We would do 6-minute walk test and see whether you desaturate when you walk. So when none of these tests could explain the breathlessness, and you have your patient in front of you saying, do something for my symptom, and you have to find out why they are breathless. So I would like to highlight about diseases that we have to think about, think out of the box when someone has unexplained breathlessness. A common entity that we have been encountering, especially after the COVID pandemic, is breathing pattern disorders, or we also call them dysfunctional breathing, where your breathing has become dysfunctional. So as I mentioned earlier, we have to breathe through the nose. We have to breathe nicely from the lower thorax using the diaphragm. It has to be quiet, rhythmic breathing. If something causes this breathing pattern to go a disarray, then you end up with breathing pattern disorders. There are several types of breathing pattern disorders where you start using the wrong muscles to breathe. Then a person with breathing pattern disorder start using, you can see that they use their upper thoracic muscles or the upper chest muscles a lot. You can see a lot of tension in the neck area. You can see that the respiratory rate or the rate of breathing becomes very high. And then there are types where you breathe so rapidly, you take rapid shallow breaths that you wash out an unnecessary amount of carbon dioxide. So the air that we breathe in, we take in oxygen and we expel carbon dioxide. That is good. But if we start expelling too much carbon dioxide by too much rapid breathing, then we get symptoms of hypocarbia, which can be quite disabling. Then some others may start using the abdominal muscles too much, trying to expel air from the use of abdominal muscles. And we also call it thoraco-abdominal dyssynchrony, where your chest and your abdomen are not moving in synchrony as it should do in normal breathing. So you have several types of breathing pattern disorders where you're breathless, you feel suffocated, you feel that you don't have enough breath in your chest, and you have to take deep sighing breaths from time to time to fill up that inadequacy. Or sometimes you may end up with fuzzy headedness, lightheadedness, neck pains, back pains. So all sorts of a whole spectrum of symptoms if you are using the wrong muscles or if your breathing pattern is not right. So when we suspect a breathing pattern disorder, we can't just look at someone and say, fine, you have a breathing pattern disorder. We have to assess properly. So we have to do the basic investigations properly. We also get the trained physiotherapists to do their assessment. There are tests where they put their hand on the chest and abdomen. They are called high-low test and MAM test. There are several tests where they can see whether we are using the wrong muscles to breathe or what is going wrong with our breathing. There are questionnaires called the Nijmegen questionnaire, where simple questions are asked to see whether you are having a breathing pattern disorder. We can observe and we do a scoring called the BPAT score, or the breathing pattern assessment tool score, where we can score, and if you're at high risk of breathing pattern disorder, then we have a tendency to do further tests. to confirm our diagnosis. So one objective assessment when you have a lot of investigations to say that you can't explain the breathlessness in a patient is cardiopulmonary exercise testing. So cardiopulmonary exercise testing has now been available in Sri Lanka over the past couple of years, I would say, and it is now widely and it's slowly spreading, and people are becoming more aware of the importance of cardiopulmonary exercise testing. So CPET, we call it in short. What happens is in a CPET we will ask of the person to ride a static bicycle. We call it the cycle ergometer. We can also do it on a treadmill where you will be asked to run. So in a cycle ergometer, the patient will be riding the bicycle, and we will be slowly increasing the resistance. Meanwhile, we will also check the oxygen, carbon dioxide, blood pressure, ECG, and the breathing pattern while the person exercises on the cycle ergometer. So in this test, we are actually putting a person at stress. Because if you see, most of the investigations that are done at rest, but you get your symptoms when you're doing something. So it just makes it practically more justifiable to get the person's symptom, get the person to exercise to the maximum, and see what is going on. So as I said, so in a CPET, we will see if there's something wrong with the heart, if there's something wrong with your ventilation, if there's something wrong with your blood circulation, or if it is just a breathing pattern disorder. So it helps us to exclude any underlying, even subtle cardiac or lung conditions, and to see whether there's a breathing pattern disorder. So if someone is diagnosed with a breathing pattern disorder, then after excluding other causes, then the main management is breathing retraining exercises. So it is good because you don't have to swallow any pills. It is very user-friendly because you just have to learn some exercises from a trained physiotherapist who knows about these breathing retraining exercises and these breathing pattern disorders, and then you have to work on getting your breathing pattern back. And once your breathing pattern is normalized, then you have to start on regular fitness exercises. It is important to treat the breathing pattern disorder first before you start exercising, because if someone just goes for exercises, then you will still be using your wrong muscles to breathe, and you will get your symptoms again.
Going on from there, doctor, is there a particular age in a person, male or female, or could it be different with the gender, where this condition will start to manifest? Say somebody in their 30s, 40s, 50s.
Right. So actually we see this condition in the whole spectrum of age, I would say. So we have lots of ladies, gentlemen, children coming from all ages with this symptom and with this condition, and we have successfully treated most of them. Most of them will be treated in 1 or 2 sessions of breathing retraining. Some would require more, and it will also need motivation and persistence. So yes, so even in children, in adults, we see that. And also I have to mention that we saw that in athletes as well. Athletes who couldn't train as they used to do before the lockdown period. So then they will also they may also develop difficulty in breathing when they start training again. Sometimes we come across people who have been labeled as asthmatics, and actually it is not their asthma that is the primary diagnosis or the cause of the symptom. It can be a breathing pattern disorder. But of course, before we pin down and say that someone is having breathing disorder, we always exclude other causes that can be treated otherwise.
So that is through tests?
Through testing, yeah.
And doctor, how long would it take to actually overcome this? You've said that some may be put right with 1 or 2 sessions, but others may take longer. But again, if there are underlying causes, then it has to be taken, as an individual case.
Yes, of course, that is correct. So it is an individual approach that we do in the management of these patients, as in all other conditions. I mean, you label someone with a disease, but the management in each person is different to another person, because one body is different to another. The metabolism, the psychological build up, the impact from the family, everything differs, and everything has an impact on the outcome of a disease and its management. So we do individual basis. So, for example, I would say now, if someone has asthma, so asthma is a common entity where breathing pattern disorders also manifest. So when we have someone with unexplained or uncontrollable asthma, then we first optimize the asthma management with usual guideline based management. And if the patient has symptoms that are fitting into a breathing pattern disorder, unknowingly the patient will be taking additional puffs, thinking that additional inhaler puffs, thinking that it is the uncontrolled asthma, whereas it can be something else. So then we have to manage both, find out which symptom is which is caused by which condition, and manage appropriately.
Thank you. Now, do you come across this condition with children as well? You said there's no sort of barrier, but then in which case is the condition being treated by a pediatrician or by somebody like, a qualified chest physician?
Well, as an adult chest physician, I have seen this in children in their teens, 13s, 14s, who come usually as breathlessness unevaluated, or they will have a background diagnosis of asthma, and then we will go through the normal diagnostic pathway and go for treatment. Commonly we see the hyperventilatory type, where there is lot of rapid shallow breathing and washing out of carbon dioxide. And also we see the apical muscles being used for breathing, that is the upper thoracic muscles. Even when you look at a person, you can see the neck muscles being very tight and tense, and they will complain of neck pains, headaches, difficulty in concentrating during studies and all that. But they are unexplained. But actually, when you think widely and you do your tests, you do a CPET, and you look at the breathing pattern, you identify the disorder, and then you can start treatment.
What about a person being slim or obese?
Actually, there is no relationship to that. There's no direct relationship, I would say. But indirectly, if you take someone who is obese and sedentary, then you tend to be deconditioned. That is, if you do not exercise, and if you sit the whole day, your body becomes deconditioned. And deconditioning is another reason for you to feel more exhausted and tired and breathless all the time. So deconditioning is another entity which causes these unexplained symptoms.
So what is the treatment? Is it medication, or are there exercises, or like de-stressing? Is it like counseling?
So for breathing pattern disorders, it is basically breathing retraining exercises with a trained physiotherapist, where they will teach you, they'll teach you what's going wrong, and they'll teach you which muscles to use and what exercises to do to get the breathing right. And once you have got your breathing right, it is regular fitness exercises. So you really need to work on your exercises, because if someone becomes deconditioned at a young age, that we unfortunately see when we do CPETs, you're not performing to the fitness level that you should. It gives rise to prolonged complications. Even if you have a simple viral infection, you will take time to recover. If you have a simple surgery, you will take time to recover. So it's important to so it's back to basics. So you do the exercises, you have a good nutrition.
But are there any patients who will continue to have this condition, not because they have not been treated for unexplained breathlessness, but there could be another cause, which means they therefore, irrespective of whatever you do, to the best of your ability to help them to overcome the problem, they still will have the condition because there's something else that is leading to it?
Yes, of course. So if they so we always keep an open mind. That is, we have to always find out whether there is an underlying condition. If someone does not improve, there may be times where we have to repeat the tests. There can be instances where there can be underlying stress, anxiety, which can lead to these kind of symptoms. So yes, we have to keep an open mind and explore all possibilities to treat.
Doctor, what is your take-home message?
Well, I would say as a take-home message, it is COVID or no COVID, lockdown or no lockdown, there is no excuse for us to not exercise. So the take-home message will be, wherever you are in whatever stage of your life, do your fitness exercises. That has a very good impact on not only on your physical health, but also on your mental health. And it will be important to be happy and be successful in your life.
Right to that question, Doctor. When you say that they have to exercise, so it will of course vary from age group to age group, in the sense that somebody who's young will have to exercise more, as against somebody who may be in their maybe 60s, 70s. It will be a different pattern altogether. So when you say regularly, would you recommend every day or X number of times a week?
Well, I would safely fall on the general recommendation of 3 times per week, but I think it will be a good topic for another day with the sports physician who will be discussing you. I would say.
Thank you, Doctor. Maybe, perhaps, because you're going into an area that is, I would say, you think it's just outside your boundary. And there we end this interesting discussion on unexplained breathlessness. Thank you very much, Dr. Ruwanthi Jayasekara, for sparing your valuable time in the midst of your busy schedule to be with us on the program and discuss this interesting topic. We certainly appreciate it. On the program tonight was Dr. Ruwanthi Jayasekara, Consultant Chest Physician, National Hospital of Sri Lanka. Thank you very much, Doctor. My thanks also go to Malinta Deshapriya for technical assistance. I'm Fatima Razi saying good night and looking forward to your company next week, same time, on Views on Health.